Let's see psychiatric topic today. First, we have anxiety disorders. In anxiety disorders, we have phobias. Phobia, we can start from sociophobia, fear of society, fear of heights, acrophobia, fear of open space, agoraphobia, fear of closed space, claustrophobia, hydrophobia, fear of water, hematophobia, fear of blood, synectophobia, fear of darkness, pyrophobia, fear of fire, mesophobia, fear of dirt and germs, monophobia, fear of being alone, zoophobia, fear of animals, and xenophobia, fear of strangers. Here we need to concentrate on sociophobia, acrophobia, and xenophobia. Sociophobia, they are fear of society. They can't able to communicate with a group of peoples. Likewise, when we see about agoraphobia, they will be fear of getting out of their own homes. They can't able to even get out of their place, comfort zone. Xenophobia, they will be okay in a societal place, they will be okay to get out of the places, but they are very scared to talk to the strangers. So all these three we need to be clarify and clearly understand it. OCD, obsessive compulsive disorder. It is an preoccupied thoughts which is making them anxious, and they are doing the repeated activity which will reduce their anxiety. In this condition, we need to explain to the patient that it will make them tired or they will be delaying with their daily activities. So we need to encourage them like that. We cannot say or we cannot stop them while doing their anxiety reducing activity. PTSD, post-traumatic stress disorder. In this, might be the patient experience some kind of trauma. It can be anything, maybe being alone in a room or just closed up in a very short space, anything it can be. So that experience will be keep repeating in their mindset, and they will be scared. These thoughts will be coming as a dreams and a repeated thoughts, or is a post-traumatic stress disorder. We will encourage the patient to be in a supportive groups and asking them to express their feelings and giving them the rationals for their feelings and encouraging them to be participating in activities to make their anxious level decrease. Mood disorder, we have two types, mania and depressions, and when the both disorders will be present, it is an bipolar. Mania, the patient is very active, very aggressive, they will be risk for trauma, falling down, they will have flight of ideas, loss of appetite, all those things. In depressions, it's just opposite. The patient is very silent in a corner of the room. They will not be exploring their self and they will not be expressing their self. And in this condition, the patient will be having high risk for suicidal thoughts. Both has a different medications, like different treatments. In a depression patient, we will encourage the patient to be with help. Anxiety disorders will be taken care, and they will be with a self-care deficit. So we will help them in a self-care. We will encourage them to be getting out of the suicidal thoughts, all these things. And in the mania, we will give them the patient lithium carbonate to reduce their hyperactivity and to encourage them to sleep, to the rest and all the things. While we are giving lithium carbonate, we need to make sure the lithium toxicity level. Eating disorder. We have two types of eating disorder. One is anorexia nervosa, the other one is bulimia nervosa. Anorexia nervosa, the patient will be not taking food orally or they will be starving excessively. In bulimia nervosa, the patient will be eating food and they are going for a vomiting. Both the condition, the patient will be high risk for malnutrition and they will be having multivitamins deficiency. So once the patient is diagnosed, the first concentration we need to give is on their multivitamins and on the electrolytes imbalances. We need to increase them to their dietitian nutrition practice, and we need to make a proper plan of meal to them. We will explain them why they need to have and maintain their body conditions. We will encourage them what is the normal physique of the person. They will be very fear of weight gain. They will be very fear of putting on weight, in the personality disorder, all these things we need to be very careful. These persons are very high risk for ulcers, tooth decays and starvation up to the death level. Cognitive disorders, delirium, they will be having temporary confusion and disorientation, dementia, progressively losing memory, learning, communication and motor coordination, amnesia, they will be forgetting past information and they cannot able to recall or learn new information. Retrograde is an past, anterograde is an new intervention. Interventions: observing the client, simple games and activities, assisting with self-care deficit. Somatoform disorders. In this, there is conversional disorder and prehypochondriasis disorder. In this condition, the patient will be feeling they have some illness, they have some symptoms for the attention seeking. Conversion, they will be thinking that they have motor or sensory problem like blindness, they cannot able to see, they are paralyzed, their part of the body is not working, all these things. Hypochondriasis, they have a preoccupied fear of having severe disease and excessive non-prescribed medications they will be taking on repeated visiting to the physician. Personality disorder, we have paranoid disorders, antisocial personality, borderline personality. Paranoid disorder, they will be always doubtful on here and there. They will be thinking that this person might be having so and so, that, like they will be harming them, they may do some kind of ill to them, all these things. Antisocial personality, they will be having a criminal thoughts, behaviors, and they will be blaming others for their mistake. Borderline personality, they have mood instability, self-image, pouring will be very less, and there will be anger always, they will injure themselves. Histrionic personality, they want attention seekings. Narcissistic personality, they do mistakes and they will make others to feel that the person has been done a mistake and taking advantage of them. Avoidant personality, they will be socially inhibited, extremely sensitive to negative evaluation. Dependent personality, always depending on someone, activities, someone's words, everything. Schizophrenia, it is an psychotic features disorder of thoughts, affects and feeling expression. Signs and symptoms, their body will be distortion, they may neglect self-care activity, motor impairment, immobilization, waxy flexibility, holding the same position for a long period of time, echolalia, repeating same words again and again, echopraxia, repetition of the movements, ambivalence, inability to make a decision or judgment about the person or situation, abnormal thoughts, circumstantiality, there will be countless details and explanation before setting to the points. Confabulation or own creation of story, they will create their own story whichever back gap is there in their fantasy world. Flight of thoughts, they will be jumping from one speech to the other speech. Loosening of association, no two related sentence. Thought blocks, they will be stopped suddenly speaking. Word salad, mixing of words. Neologism, they will create new words and they know only the words by themselves. Types of schizophrenia: paranoid schizophrenia, hebephrenic schizophrenia, catatonic schizophrenia, residual schizophrenia. Characteristics: suspicious delusion, persecutions and auditory hallucination. Hebephrenic schizophrenia, disorganized thinking with inappropriate emotions. They will be inappropriate in laugh and flat affects. Catatonic schizophrenia, strongly decreasing or increasing the motor activity. Residual schizophrenia, one or more episode of schizophrenia. Intervention: during the same environment, packed food for the paranoid schizophrenia, monitoring their suicidal risk, and providing simple activities. Delusion, false perception. There are grandiose delusion, persecution delusion, delusion of jealousy, somatic delusion. Grandiose delusion, they will think they have superpower. Persecution delusion, they feel they are inflict injury. Delusion of jealousy, they thought others are jealous of them. Somatic delusion, they feel they have serious physical or motor problem. Interventions, we need to encourage them to explain the condition and do not argue with the client. Hallucination, we have 5 types: auditory, visual, olfactory, tactile, gustatory. Sensory perception that has no external stimuli. Without any stimuli, they will feel it, that is hallucination. Intervention of hallucination, we will encourage the patient to explain. Tactile hallucination, we will not allow the patient, we will not touch the patient, so they will be exaggerated, exchange client with activities. Defense mechanism: compensation, putting an extra effort to achieve in the area where one has real or imagined deficiency. Displacement, feeling towards one person is directed to another who is less threatening. Fantasy, gratification by imaginary achievement. Identification, there will be attempt to change oneself to resemble an admired person. Intercession, there will be identification of which traits and values of others includes to self-projection. Projection, transfer to self-values and unacceptable ideas into others. Rationalization, giving a rationale for their unaccepted behavior. Repression, unconscious process which blocks the undesirable behavior. Suppression, conscious deployment forgetting to paint thoughts and ideas. Supplication, expression of anger in a social acceptable way. Example, exercise. Psychiatric disorders, we have typical and atypical drugs. Typical drugs, haloperidol, chlorpromazine, typical, olanzapine, risperidone, clozapine. Antidepressants, TCA, tricyclic antidepressants, imipramine. Signs and symptoms of this medication: drowsiness, cardiac toxicity, orthostatic hypotension, urinary retention, fluoxetines and paroxetine and some of the SSRI medications. Signs and symptoms again here: importance of sexual ability, nervousness, photosensitivity. Mood stabilizer, lithium carbonate, therapeutic level is 1.2 MEq. If it is more than 1.5 MEq, then it is toxicity. Side effects, we can see diuretic effect, polyuria, to be avoided, caffeine, tea, cold or anything. Inability to concentrate. Signs of toxicity: suicidal client monitoring, diminished concentration, muscle switching and severe diarrhea. Anti-anxiety drugs, benzodiazepines, contraindication is glaucoma. Signs and symptoms: blurred vision, ataxia, dizziness and hypotension. The last one is ECT. We use mostly this one in a depression patient and a paranoid schizophrenia patient when it is not acting according to the medications. This is an grad mal seizures will be passed with a 120 volt of electric shock to the person's brain, so the person will be getting back to the normal stage. Adverse effect: brain damage, memory loss and seizures. Preoperatively, we want to take a consent NPO for the patient, and we will monitor the vital signs before tracking the patient to the ECT. In the intraoperatively, we will secure IV cannula for a minimal anesthesia, oxygen administration to the patient, and ECG and EEG will be connected. Postoperatively, orientation and reassurance, providing suction, assessing the gag reflex before giving the food. If any concern or doubts, please contact. Thank you.